A very good afternoon, everybody. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. OAB, overactive bladder, is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on this very topic, that what's right for diagnosis and treatment of overactive bladder, today we have with us renowned Dr. Sanjay Prakash and Dr. Mathisekaran. Dr. Sanjay Prakash and Dr. Mathisekaran are senior consultant urologist from AINU Hospital, Chennai. Both Dr. Sanjay Prakash and Dr. Mathisekaran is having rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to both of you, and it's a pleasure to have you with us today.
It's wonderful to be here, Samikta. Indeed, that was a very generous introduction. We both are consultants. We are not senior consultants yet. That's one small correction I'd like to be corrected over there. And it's good to be here.
It's a pleasure. It's a pleasure. Dr. Sanjay, my first question would be to you, sir. As we are celebrating World Continence Week, it's important for us to understand what is the significance of this week, why there is a need to celebrate World Continence Week. Please throw some light on this.
Well, this concept of World Continence Week was actually brought about by International Society. The name of the society is the International Continence Society. So this is actually celebrated in the last week of June between 21st and 27th. The main idea of celebrating is to help people who are actually suffering with these symptoms, to help them more come out and express themselves and guide them so that they'll be able to approach the right people and they'll be able to get themselves treated. It is mainly to enlighten them that these symptoms can be treated, so that they are not left alone. So the main motive is to guide them to a right channel.
Right. So it's important to understand that, suffering in silence is not taking you anywhere. Please come up and speak about it and take the help. Right. Dr. Mathisekaran, I would like to ask you about overactive bladder. We often hear about OAB or overactive bladder. What it is exactly?
Yeah, the OAB or overactive bladder is something that most of the people who hit the middle age will experience at some point of their life. But probably they wouldn't have known that it is called as OAB. It's basically a group of urinary symptoms, which results in a sudden urge to pass urine. So it could be when the patient is having a very small quantity of urine too. Usually we have an urge to pass urine when we have a 250 to 400 ml of urine in our bladder. And it becomes a painful urge when it crosses almost 600 ml. But people with overactive bladder, they tend to have an urge to pass urine even before hitting the 250 ml mark. So apart from that, this urge could result in sudden leakage also. So it's a plethora of symptoms like the urge to pass urine, the uncontrollable desire to pass urine, or even a leak with even a little bit of pressure like coughing or sneezing. That's called as overactive bladder, and it's pretty common.
Okay, so it's pretty common. And Dr. Sanjay, whatever symptoms Dr. Mathisekaran has just told us, that's it? Or you have, there are other symptoms or signs also associated with an overactive bladder?
So that's what, like he explained it, like technical terms as well. So basically the function of the bladder is function as a reservoir. It's the thing is to store urine. Like as he told, the capacity, like about 400 to 500 ml easily. So beyond that, the patient will start having, he'll want to void and he won't be able to store beyond that. So, but what actually happens here is that even before it reaches that full capacity, the patients will just, start like, feel like passing urine. So that's what we call urgency. So whenever, okay, they will just feel like this is what the thing will going on in their mind. So I want to pass urine, I want to pass urine, I want to pass urine. That sensation will be there. And before they could, okay, get up from the chair and just go to the restroom, they might not be able to hold the urine. So this is what we call as urinary incontinence. Urinary
Right.
incontinence. And then the urgency. So what they have, the feel, okay, they want to pass urine, so they might rush to the restroom. So that the symptom is what is known as the urgency. Urge, incontinence. Incontinence is what? Is what the leakage is.
Okay, so fair enough. We now understand what an overactive bladder is and what are the major symptoms. Now, talking about the causes that is responsible for OAB, Dr. Mathisekaran, would you like to elaborate the causes that are responsible for an overactive bladder?
Yeah, sure, Samita. There are plenty of causes. To start with, the old age per se, as we grow older, the risk of OAB keeps increasing for both men and women. One, and women generally after menopause, they tend to have this symptom a bit more frequently. One, and let me put this: frequency is something that is a gray area. And then usually, if one passes urine every 3 to 5 hours, that's fine. But then when they pass urine less than 3 hours, like 2 hours, an hour, or every half an hour, then it's called as frequency. So when we got that thing clear, so when this symptom becomes more frequently, this frequency symptom becomes more common in old age in men as well as women. And in men, people who have prostate issues, especially after the age of 55 to 60, they are usually having this complaints of incontinence or urgency or frequency. And people with central nervous system disorders, such as people who have had a stroke in the past, who are recovering from a stroke, or people who are having multiple sclerosis, it's a form of degenerative neural disorder. Those people have a high risk of having overactive bladder. And a very common day-to-day drinks like caffeine, carbonated sugars, aerated drinks, and alcohol, they can also predispose a person to have a overactive bladder. So these are the common causes, but then we can go in depth also. But then these are the superficial common causes.
Right. So these are the main causes that are responsible for an overactive bladder. Dr. Sanjay, I would like to ask you that Dr. Mathisekaran has just, pointed out that aging can also be a reason. Now, there are people with diabetes, there are people with hypertension or other conditions, there are people who are aging, and they normally associate, urge of urination all the time or leakage, etc., with their conditions. So they'll start living with it. They'll say that, I'm aging, so that's normal when after a certain age, or I have diabetes, so of course I'm going to the loo often because I have this condition. How true is that? I mean, can it be curable even if it's associated with aging or other conditions?
So that's what. So just, okay, looking at it, okay, talking a little bit, okay, more technically. So the bladder control is actually, okay, there are two parts in the bladder control. So one comes from the central nervous system, another is a local control. Okay, so that, so what comes is that, so that even before the bladder completely gets filled up, so there is some, sensation or some impulse coming from your brain that will stimulate the bladder to pass urine, even without it attaining its full capacity. So another thing is that what we call as a bladder instability, or the muscles of the bladder will go into contraction. Okay, so this also gives the thing of what we call the urgency and also the frequency. So what causes these impulses? Okay, because these are not the normal impulses that happens in the patients. Okay, so what causes these? So this is one. With aging, that will be, okay, some amount of neuronal degeneration and also the pathological conditions like diabetes. Diabetes means, this does not happen in all diabetes. In people where the diabetes is not controlled adequately, in them, so the same, these what we call as the neurological imbalances happen. So this OAB as results because of all these imbalances. That's what. So it's not like it's, I mean, these are all the triggers that leads to these symptoms. So if we can able to correct those symptoms then and there, okay, so then we should be able to help the patients in controlling their symptoms.
Right. So it's important to understand the cause, or technically what we say, diagnose the cause, and then you can go and prescribe the treatment or set the treatment.
Exactly. It's not necessary that it's only the aging patient or or a diabetic patient should be having all things. Generally, any patient with a urinary tract infection will also have all these symptoms. So that's what. So whatever things are all the correctable causes. Once all the correctable causes has been brought under control, then the symptoms will also settle automatically. So
right.
The next set of things, despite correcting all these symptoms, I mean, all the causes, the patient continues to have symptoms. So that's where the different set of medications and different set of treatments come into play. So that's why people should approach the right people. That's what the patient should approach. Okay, the right doctors or right consultants who will be able to guide them in the right way. And this concept of continence week it's all about that. Providing patients that guidance.
That's why we are having this session and having both
exactly.
of you, the luminaries on your field, so that we can aware people that please, if you have these symptoms, come up, talk about it, go to a neurologist and seek advice. The earlier you go, the better relief and early relief you will get. Dr. Mathisekaran, coming to you. Now we have spoken about the symptoms, the causes. Now we would like to talk about the treatment options that's available for an overactive bladder.
Yeah. So what happens to a patient when he visits a doctor or physician or urologist with these symptoms? What we generally tend to do is we like to evaluate complete history has to be elicited, basic physical examinations has to be done. So I'll tell like a story. A patient comes to me, what I'll do, I'll ask him how long he's been having these problems. What are his past health problems, whether it's diabetic, hypertension, what is his lifestyle about, and how much water intake he's been having, how this is affecting. Basically, it's a history. And once I do that, once he gives a fair idea, once I get a fair idea about the patient's lifestyle and his conditions, I will do a physical examination on him. Physical examination also includes a basic ultrasound examination. It's for both men and women. We just like to rule out other intra-abdomen, whatever organs that could cause this kind of symptoms. We'll just screen them. So that is a basic physical examination. Then I would like to go ahead and evaluate for a urinary tract infection. Do basic blood test and urine test. I just would like to rule it out because, as Dr. Sanjay told, urinary tract infection is one of the commonest causes for frequency. People might mistake this for overactive bladder syndrome. Probably they might just have a long, lingering urinary tract infection. Most of the time, we correct it and then they come back to normal. That's the other thing. And then what I say is because it's kind of a long-term issue. It's not like you come here, bam, it's gone. No, people will be in follow-up. So what I do is there's something called as a bladder diary, where you'd ask a patient to record data about how much water they are taking, how often they're urinating, what is the volume. These are basic things that you can do in home. So we'll probably do it for a week, and fast tracking it, like you can do it for 3 days also. When we have all these tests, we'll have a better idea, and then we'll be able to give treatment options for the patient in the form of lifestyle changes, which includes cutting down their caffeine or alcohol intake, or say controlling the amount of water they drink. If it's going to affect them in the night more, then probably cut down on the water intake after dinner. So those kind of things. And there are certain bladder training exercises where we'll train the patient to train the bladder. There are certain exercises like Kegel exercises. These are a group of exercises which is going to strengthen their pelvic muscles and help them have an enhanced control over their bladder. And there are certain medications. These are lifestyle changes. And then we jump into medications. If these are not helping the patient, then there are certain prescription medications It should help them to reduce the urge to pass urine. And if the medicines are also not working, then we'll go into surgery. These are the wide range of options that the patient will get in. But most of the patients will respond to lifestyle changes itself. And there's no need to go in further. And very few patients progress to subsequent stages where we have to treat them accordingly.
Right. So you have very well explained the, line of treatment or treatment options that's available. Dr. Sanjay, I would like to ask you, as Dr. Mathisekaran has just, elaborated the things that a patient can do to reduce the symptoms by lifestyle modifications, then they can go for medication, then we have surgeries, etc. One thing that he pointed out was the water intake. Now, we Indians especially have this thing in our mind that you need to drink a lot of water, a lot and lots of water to keep your system healthy. And especially with anything to do with kidney or the urinary tract, will instantly say, drink a lot of water. You're not drinking enough water. That enough water will lead to 6 or 7 or more liters of water every day. How true is that notion or the thing that we have in our mind? How dangerous or good or whatever it is for us?
Yeah. I would rather put that actually, okay, this thing called a lot of water is actually dangerous. A lot means, okay, what quantity is lot? What is lot?
One tank of water.
A patient with kidney issues, a patient who has elevated creatinine, okay, for him, he can't take the 3 or 4 liters of water. So for him, okay, lot is too much. No. So the ideal terminology, what we can put is take adequate amount of water. Adequate. For any general population, whose renal functions are all normal or they don't have any issues, 2 to 3 liters a day in form of fluids, any fluids, to put it that way. So that is what is adequate. So that's what. So generally people tell outside, take lots of water, lots of water. No. A patient with a creatinine 4, okay, lots of water is actually, it's more harmful for him. I hope it's understood. So that's what. So the thing is, it's not like a lot of water, adequate amount of water. And regarding this, okay, this lifestyle, alteration regarding management of OAB. So my colleague was talking about taking fluids, changing the way the fluids are taken. For example, okay, most of them will have symptoms in the night time. So that before they go to the bed, that is, okay, suppose the patient, he goes to bed at about 10 p.m. So you need to cut off all water intake by 8 o'clock. So at least a window period of 2 hours should be there. And before he goes to bed, he has to go to the restroom and he has to make sure that he empties his bladder completely. So these are all the initial parts, because okay, these symptoms are not like you give them medicine and then like a magic, it just cures. No, without lifestyle modification, medicines are just supplementary to lifestyle modification. I'm a staunch believer of that. So that's what. So this way he has to modify, and in addition to whatever he mentioned, all the carbonated beverages, alcohol, caffeine, and tea. In addition, and the bladder exercises, there's something known as timed voiding. Timed voiding. So that it's like if the patient he feels like passing urine every half an hour, he has to try to hold his urine. He has to try to hold his urine, so that the slowly the symptoms will. He has to confidently try to hold the urine. Hold it. So it's not like whenever he wants to pass urine, he can go to the restroom. If I feel like passing urine, yes, I'm holding. So this is actually bladder training, so that the duration with which he visits the restroom will slowly increase.
Okay. Fair enough. So
these are all the lifestyle modifications and simple things which everyone can do. But unfortunately, they think that, okay, once they visit a doctor, the doctor gives medicine and okay, everything to settle down. But I'm just telling, without all these lifestyle modifications and all these small corrections, it's all just so small pieces of the puzzle. That's what. If it's not being, these are not being corrected, medicines won't help you. Medicines won't work.
Mhm. So these small corrections will actually go a long way to help you control your overactive bladder. So please
Exactly.
pay attention, do these lifestyle modifications in case you have OAB condition or issue, or you're facing any of these symptoms or signs, and consult your urologist. That's very important. Don't just wait that these symptoms will go away, and or don't just assume that as you are aging or have other conditions, this is bound to happen. No, it's not. You
There
deserve
are
a good quality
international
life.
guidelines. Actually, there are international guidelines for the management of OAB or the overactive bladder symptoms. Okay, but what is being commonly followed is American Association of Urology guidelines and the European Association of Urology guidelines. What comes first? The first line. Okay, so they have actually categorized the treatment into different stages. What comes first? Comes first is a lifestyle modification, and the evidence for this is a strong evidence. Lifestyle. So that's what, okay, everyone's studying, and there is also so many papers regarding all these things. So lifestyle modification comes. Most importantly, smokers. Smoking has to be stopped. Smoking, everything, all these things, smoking, and then next comes the body weight, obesity. People cannot be sedentary. They have to be more active. So reducing the body weight, and then diet changes. Then comes your bladder training. Then comes your pelvic floor exercises. All these things fall under the category of first line of treatment. Without these, without following these, the medicines or next thing is not going to help. Okay, only if these are not working, then we have the second line of treatment. Then if that's not working, then we have the third line of treatment. So it's like a algorithmic approach.
Right. So foremost, lifestyle modifications. We have few questions from our viewers, and Dr. Mathisekaran, I would like to ask you. You have told us what to avoid, like Dr. Sanjay has also, added to that no or excess of coffee, tea, or anything that irritates your bladder, or alcohol or smoking, etc. is not good. You need to avoid it. Anything that we should consume to strengthen our bladder, or for a healthy bladder? Any food suggestion?
Anything that can control your primary problems. Say a diet specific for diabetes, or a diet that's specific for hypertension. If you're suffering from hypertension or diabetes, those kind of food would help reduce the primary pathology. Here, if the patient is aging, probably, and if it's a diabetic, then probably have adequate control over it. Diabetic diet, that should help. But per se, there is no magic medicine or magic food which is going to reduce practically, by just avoiding and eating right. Eating right per se, like reducing the consumption of caffeine and the drugs which can, avoiding spicy food will also go a long way in reducing OAB. So whatever you eat is going to come out in the urine. It's going to be excreted. So if there's something that irritating substances like spicy food has got caspacine, which is the molecule that is responsible for the spiciness, it's going to get excreted in the urine too. It's going to irritate the bladder mucosa too. So if you try to avoid those things, you'll be fine. But per se, I'm not aware of any such medicine. A food that's going to just bring down the overactive bladder magically. Those things are called as medicines, not food.
So no magic food, but yes, the magic mantra is have a good lifestyle, healthy lifestyle.
Exactly.
That will go a long way.
We can't have a huge burger and biryani for lunch and expect the weighing scale to go down. You have to change the lifestyle just to get the things done. These are not done overnight. These take some time.
Exactly. Small things will actually,
Makes a huge difference. Exactly.
Yes. We have Gajendra Kaushik asking, Dr. Sanjay, I would like you to answer his question. His question is, can prostate disease cause OAB?
Yeah, Definitely, that is one of the most common causes in males, actually.
Mhm.
So, basically, so what is a prostate disease causes actually? So it also it interferes, alters the bladder storage function, as well as it also the speed with which they pass urine. So what we call as a functional symptoms. Functional symptoms is nothing but what the bladder storage capacity. I mean the storage symptoms and voiding symptoms. Voiding symptom is what when you have difficulties with passing urine. In males, obviously, the most common cause for a OAB is a prostate issue. Yes, and
Okay.
how early? Okay, you think okay this will start? This can start right from the 30s itself. We have seen patients coming with these kind of symptoms between 30 and 35 itself.
Right. So it's better not to ignore these symptoms or signs. Please consult your doctor as soon as possible if you have these
Yes.
symptoms. Dr.
I
Mathisekaran,
sincerely advise that
yes.
advise the listeners here. So let it be the small symptoms also. So whatever is it, if we can pick up in the early stages, and also so we be able to guide them well, and we be able to treat them well. So let it be okay. Any symptoms, one single consultation is not going to cost them much. So, but that's what I would like to advise them, that please, the whatever symptoms is that, meet the experts at the early stage. Always picking up things at the early stage, we'll be able to treat them well, and it will be effective at the early stages itself.
Very well said. Dr. Mathisekaran, next question is for you, sir. Sonia Iyer is asking, what causes overactive bladder in females?
Hi, Sonia. So, as we discussed this in the early stages of the conversation, um, see the hormonal changes per se post menopause. That is after the menstruation stops in the females, probably in the late 40s or early 50s. That itself is a cause for overactive bladder. And beyond that, as we said, all the food substances that I said, coffee, tea, and all those things. And the most common cause that is commonly ignored is urinary tract infections. The urinary tract infection is more common in women when compared to men. There are anatomical reasons for it. The urinary tube is lengthy in a male, it's almost 20 centimeters, whereas for females, it's only 4 centimeters. And the proximity of the urinary opening to the anal opening, where we pass the feces, because that is one of the most common cause of contamination. For again, in males, it is almost 15 to 20 centimeters. For females, it's only 4 centimeters. The proximity of the anal opening to the vaginal opening, as well as the short urethra, that is the tube that connects the bladder to the exterior. These two are the common causes for females to get infected very commonly. So this urinary tract infection per se will cause a lot of overactive bladder symptoms. So beyond that, it's the basic things. And beyond this factor, females are not at disadvantage when compared to males. Diet-wise, diabetes, hypertension-wise, they're going to suffer commonly. Men, it's going to be the prostate. Women don't have prostate. But after menopause, the hormones go down, and the skin around vagina becomes more coarse and dry and less elastic. So people, especially elder women, will have something called as obstructive symptoms. The urine passage will be narrowed down. They may not void the pass the urine completely. They may retain some urine even after voiding. So those things will add to urinary tract infections. So when they have UTI, that will also express itself in the form of overactive bladder. Beyond this, I don't think there's gender bias over here. At least OAB doesn't have gender bias.
In addition, I would like to just add we've seen elderly females with hypothyroidism also presenting with these kind of symptoms more commonly.
Okay.
So in fact, okay, when they come to us with these symptoms, and subsequently we have directed to them to be hypothyroid, so that okay, we have corrected them, corrected the hypothyroidism, and symptoms have also been corrected to some extent. So that's what I just like to add that in between.
Okay, Dr. Sanjay, I would like to, lead the second question to you only. Rohit John is asking, what side effects might the medication cause, and what can I do to help manage them?
Okay. Okay. Now we have a lot of latest medications for that, which specifically act on the bladder. So the previous generation of the medications will just act on the own body, so that it will cause multiple symptoms like dry mouth, constipation, so those kind of issues. But what medicines we have in a repertoire nowadays is that it's all more specifically acting on the bladder. So as such, the side effects or the percentage will be very minimal here. So whatever we've prescribed so far, okay, we have not seen patients coming back to us and just complaining that we got this, we got that. So that's the advantage we have nowadays for more specifically acting medicines.
That's good. That's a good news for all of us. Dr. Mathisekaran, we have A. Raju with us asking, can OA be cured? I would also like to add, is it completely curable? It's easy to treat. What's the scenario?
Raju sir, vanakkam. So the thing is, OAB is not like a fever. We have fever, typhoid, malaria, something. We just took a medicine and then it goes off. OAB will happen over years. So it won't happen over a day. So as we discussed, we have to get to the root cause of it. It could be, as we discussed a number of times, could be diabetes, hypertension, lingering urinary tract infection. The urinary tract infection could be because of multiple causes. It could be because of the stones, or it could be because of prostate issue. It could be anything. So we have to treat that cause, and OAB can be controlled. So we will be bothered about it only when it is going to affect our lifestyle. If I'm working in my hospital and if I'm seeing a patient, and if I have to get up and go to the toilet every hour, then I'm going to be bothered. If I'm operating and then if I have to stop the surgery and go and take a loo, I'm going to be bothered. So while I'm sleeping, if I'm getting up every 3 hours, 4 hours, and I'm having a poor sleep because of it, I'm going to be bothered. So these are the bothersome symptoms. But if you come at that level where you're bothered and we give lifestyle modification, medicines, or whatever it may be, and it can come down to a point where it is tolerable. And very few cases where we find to the root cause, like stones or outlet tract obstruction, like prostate, or in females, it is urethral narrowing. And if we address it, most of the time it will just vanish away. But to put in the perspective, it is not black and blue. You know, there are gray areas. There are some patients who are with us in a long-term follow. They will have bad days, good days, where they're happy, and sometimes it comes back. So we have good medicines, safe medicines, as Dr. Sanjay told. These medicines act particularly on the troublesome receptors which are causing these symptoms. So in that way, we'll be able to control it. Cure it, not for all. Maybe cure is not something we are looking for here also. We are just going to give a better quality of life to the patients. That's what it is.
Yeah, as it hampers the quality of life, it's important that you recognize those symptoms and signs and consult your urologist rather than just waiting or just have this notion in your mind that you'll have to live with it. No, you won't. You can have a good quality of life. We have our Ajit asking, if my OAB gets better, can I stop taking the medication?
Yes, definitely. So just in a nutshell, okay, so about the treatment of this OAB starts with, okay, treatment of the root cause, okay, and then medications. Then the third part is improving the quality of life. Okay, so we are able to achieve all these things with medicines. We can give them a trial without medicines. A trial means a trial for about 2 to 3 months. So 2 to 3 months, like if he's doing well and all the lifestyle modifications, whatever we have discussed, helps them, definitely we can give a try without medications. And 2-3 months, he's doing well, he can continue to be without medications. Once he redevelop the symptoms, so that is the time we have to intervene and we'll have to evaluate him again. So what news that a 40-year-old gentleman, okay, coming with that thing, okay, his evaluation will be different. But the same thing, a 60-year-old gentleman, okay, comes again, then okay, then his evaluation will be different. So that's what. So definitely the so-called this drug-free period is possible. Yes. Yeah, we would do that. Once he's happy, yeah, his quality of life is improved. Most of the patients ask us, sir, can we stop the medications? Yeah, if you're feeling comfortable, if you're feeling good, definitely okay, we can give a try without medications. And this is where the bladder diary plays an important part. So before starting the treatment, okay, we know how we voids, and during the treatment, we'll also know how we void. So we have a baseline to compare with whether there is improvement or no improvement. If you are convinced, okay, there is definitely improvement, and the patient also says, okay, his quality of life has improved, he's feeling good and happy, definitely I would give him a trial without medications.
That's good. That's wonderful. Dr. Mathisekaran, as we are moving towards the conclusion part, I would like to ask you one thing, that how dangerous can an overactive bladder be? Is it life-threatening, or it's just that it hampers the quality of life? Plus anything that you would like to add at the end?
Overactive bladder is usually not life-threatening. It's bothersome. People would say, they won't even say it is a disease. They would say it is a bothersome issue. Very, very rarely, the overactive bladder, that is the frequency urgency, is a plethora of symptoms that we discussed initially. So it has to be completely evaluated. We need to do an ultrasound at least. If it is retractable, that it's not responding to any medicines, then probably you have to look into it. Are we missing anything more sinister? There could be some form of very sinister pathologies which can act as of producing an overactive bladder. So that is why again and again, as we emphasized, you have to go meet a qualified physician who knows about this. If we just the medicines is not working, change the medicines. It doesn't go like that. We have to hike it up, evaluate. Very rarely, there are some sinister pathologies, but that's why by proper evaluation, we'll be able to do it. It is not life-threatening. 99.9%, it is just bothersome, and most of the time we'll be able to get it under control with good lifestyle change, bladder training, and medication. We do rarely see surgeries. Very rarely surgeries for it. It doesn't go to that extent also.
Fair enough, fair enough. And Dr. Sanjay Prakash, before we conclude, last, thing that you would like to discuss or say to our viewers, any message from your side?
Yes, I think I've already discussed most of the messages. Okay, what I wanted. So that's what. Please do not ignore any symptoms concerning your urinary tracts. So you have a lot of experts in your place, or just consult your local doctor. So he should be able to guide you well. So please do not, okay, irrespective of the age, okay, don't go to the thing that, okay, it will subside itself. So just any symptoms, any doubts, okay, there are so many ways of approaching a doctor nowadays. Okay, there are online consultations, telephone consultations, at least, so that okay, you can talk to them directly, okay, at your home also. Then you can find out. So then okay, then if we need to see you in person, definitely, so we'll ask you to come. So please do not ignore your symptoms, and please maintain a healthy lifestyle. Whatever is it has to be under control. So that's what. So too much of something is good for nothing. So just the way it goes. For example, smoking. Please control your smoking, and then the alcohol. More importantly, yes, I saw someone asking about alcohol. Yes, alcohol in constant, longer, large doses will also lead to OAB. And please maintain a healthy pattern of life in the form of exercise, regular exercises. Right. So these are things. Following these things can avoid a lot of issues in your life.
So stay healthy, have a good lifestyle, and don't ignore your symptoms. Thank you so very much, Dr. Sanjay Prakash and Dr. Mathisekaran. It was a pleasure to talk with you. Thank you for your valuable time. And it has been quite an informative session for our viewers. And we really look forward for many more such sessions in the coming times. Thank you so very much.
Yeah,
It was
definitely.
nice, wonderful.
It was a good session. It was our pleasure addressing our viewers also, and we be there to help them out anytime they need.
That's wonderful. That's wonderful. We would also like to thank our viewers for your excellent and active participation. For more information and updates on the overactive bladder, stay connected on our FB page, Bladder Wellness. We are also available on YouTube.